Growth hormone deficiency, symptoms and treatment. Growth hormone deficiency is a rare condition. It can be congenital, present from birth, or a person can acquire it during childhood or adulthood. The age at which growth hormone deficiency or GHD presents may determine the symptoms. The signs and symptoms of growth hormone deficiency in children may include a slow growth rate and reduced facial bone development. Adults may notice unexplained decreases in muscle mass and experience low energy levels. Most people tend to receive a growth hormone deficiency diagnosis as children. A doctor will treat growth hormone deficiency in both children and adults with injections of growth hormone. This video will explain growth hormone deficiency in more detail, including its symptoms and treatment. What is growth hormone deficiency? Growth hormone deficiency arises when the anterior pituitary gland does not release enough growth hormone. The anterior pituitary gland is part of the pituitary gland, which is a crucial gland because it produces many hormones. In some cases, children are born with growth hormone deficiency, but others may acquire it during childhood. Adult onset growth hormone deficiency is always acquired. In both children and adults, the cause is not always known. Congenital growth hormone deficiency. Abnormalities in certain clusters of genes could predispose someone to growth hormone deficiency. The condition can sometimes run in families, but this is rare. Some people born with growth hormone deficiency may have a smaller or missing pituitary gland. Acquired growth hormone deficiency. Acquired growth hormone deficiency may result from inflammation, infection, tumors in the pituitary gland, radiation therapy or brain surgery, autoimmune disease, severe head injury, lack of blood supply to the pituitary gland. Signs and symptoms of growth hormone deficiency. Growth hormone deficiency can cause many symptoms, with some being more subtle than others. In children, congenital growth hormone deficiency presents at birth. A child with acquired growth hormone deficiency will develop symptoms as they get older. Often, children born with growth hormone deficiency are atypical size at birth. The most telling sign of growth hormone deficiency is a slow growth rate. If a baby grows at an average rate from 6 to 12 months, it is unlikely they have growth hormone deficiency. Other signs and symptoms in children include low blood sugar in newborns, a small penis in newborns, the fontances of the skull not closing in newborns, fine hair, reduced nail growth, high voice, excessive abdominal fat, slow development of long bones, slow development of facial bones and teeth. In adults, people who acquire growth hormone deficiency later in the life have different symptoms. The symptoms of adult onset growth hormone deficiency include an unexpected decrease in muscle mass, an unexpected increase in fat, lower energy levels, difficulties with memory and concentration, depression or anxiety, a reduction in bone strength, an increased level of low density lipoprotein, cholesterol, osteoporosis. Treatment of growth hormone deficiency. The recommended treatment plan for growth hormone deficiency is similar in both children and adults. Treatment in children. The treatment of growth hormone deficiency in children involves injections of recombinant human growth hormone. It is important that children receive a diagnosis quickly so that treatment commences as soon as possible. The earlier a child receives treatment, the more likely they are to grow at the typical rate. Treatment may continue into adulthood after retesting and assessment. Treatment in adults. Adults also receive recombinant human growth hormone injections as part of their treatment plan. As growth hormone deficiency may continue to cause problems when a person's growth is complete. Those who receive treatment as children may continue to do so as they get older. This continued treatment can prevent the loss of muscle mass and other effects of the condition. In 2020, the Food and Drug Administration (FDA) approved the first weekly rather than daily injection for adults with growth hormone deficiency. Seeking a doctor. Endocrinologists are doctors who specialize in hormone conditions and treat growth hormone deficiency in both adults and children. People may receive a referral to an endocrinologist through primary care. Growth hormone deficiency is rare, and doctors often diagnose it in children. The sooner treatment starts, the more likely it is that a child will grow at the typical rate. Treatment for adults living with growth hormone deficiency also includes growth hormone injections. These injections help alleviate the symptoms, which may include a loss of muscle mass and low energy levels.